Yes, okay, ma'am.
Okay, so if you've read and understood, considering it communication skills station, please begin.
Hello?
Yes, hello.
Yes, I am Dr. Mahir, one of the surgical doctor here. And I am calling to, I am working with Mr. Mann, and I am calling to speak to the on-call surgeon to update him and inform him about a patient post-operative mastectomy. Can I check that I am speaking to the on-call surgeon?
Yes, I'm on call consultant.
Yes, I have this Mrs. Sarah. She's 70 years old, and she's known case of a chronic obstructive lung disease, and she have history of mild left ventricular failure. She's in the postoperative day 2, post mastectomy and axillary clearance. She's clinically having axillary swelling, and she's having shortness of breath. Her drain is draining 90 ml of blood, and her daughter want to take her home today, and I wasted 20 minutes to convince her that taking her mother is not home is not in her best interest, but this is not successfully.
Okay.
So she want to take her home.
Okay. So, has the patient made their own decision, or she has been brought into the making a decision to go home today?
Yes, actually, the daughter convinced her mother that it will be best for her to take her home, which is 60 miles away from the hospital. So the patient was willing to go her own house when she is well enough to be discharged. But she is competent. She convinced her.
Okay. Is the patient alert and capable to making her own decision?
Yes, the patient have the enough competency to make her own decision.
What do you think has happened to this patient?
Yes, in the view of our axillary swelling, this could be having hematoma or hemorrhage from clip in the surgical wounds, and also considering her shortness of breath, this could be pulmonary embolism.
What the causes of bleeding?
Yes, that could be a slipped clip or reactionary hemorrhage.
What is the cause of shortness of breath?
Yes, this could be due to pulmonary embolism, which I suspect, and also her heart failure could cause this. And I would consider that she's having exacerbation or acute attack of her chronic obstructive airway disease.
Causes of axillary swellings?
Yes, this could be due to collection of hematoma or due to the axillary vein thrombosis, or could also be due to collection of lymphatics or seroma.
Okay. And what will be your plan of action in the event this is the complication?
Yes, in case of in case of hematoma, I will check her hemoglobin to check that if there is drop or not. If there is ongoing bleeding, then I will resuscitate, and I will consider later on evacuation of the hematoma after checking her coagulation profile. And if this is axillary vein thrombosis causing pulmonary embolism, then I will do CT pulmonary angiography, and I will treat accordingly. Yes, and Yes.
Okay. Is she stable?
Yes, she's stable, but I should first confirm if there is the diagnosis of pulmonary embolism, if present or not.
Is it safe if she is stable to send her home?
No. It's not safe to go home because she's having shortness of breath at the meantime.
What will you do if they were insisting to go home?
Okay, I will discuss with them the complication, and if they are insisting, then I will tell them about that they will sign an indemnity form. That's a legal form, and that stating clearly that she understand her condition and the seriousness of her condition, and she understand the complication, and she want to go against medical advice, and she also knows all the adverse events, and she take the whole responsibility. If she is willing to go, then I will tell her about the warning sign that should if there is any increase in her shortness of breath, or she is going unwell, more unwell, that she should go to the nearby clinic or come to the hospital.
Okay. What you do for the drain if it's 410 ml?
In this case, I will leave the drain in situ, and I will teach her how to care for her drain. And I will try to involve a local nurse or community nurse. And I will also tell her if it's becoming less draining, then to go for a nearby clinic to remove it.
Okay, thank you.
Okay.
We will, yes.
Thank you very much. I'll give you an update about the patient.
Yes,
Thank you
okay.
for your time.
Thank you.
Okay.
Still have 40 seconds, so maybe you can summarize your plan of action.
Yes, okay, I will discuss with the patient, and I will, if she's insisting to go, then I will I will let her sign indemnity form, and then I will discuss with her about the complication and the warning sign that if happens, then she should go back to the near clinic or should come here back.
Good. Thank you.
Yeah, thank you.